All right, 56 past the hour, folks. Want to go now to conditions at the U.S.-Mexico border. Health and Human Services reporting that an unaccompanied 15-year-old from Guatemala died Monday at the El Paso's Children's Hospital in Texas. HHS saying the teen had a pre-existing condition and was hospitalized when she was transferred to custody from Border Patrol. This brings the total to 4 unaccompanied migrant children who have died in U.S. custody this year. Joining us now from Texas, near the border, Fernando García, Executive Director of the Border Network for Human Rights. Fernando, thanks for joining us. We appreciate it. You have asked that HHS be transparent about the medical care, specifically as well for migrant children. What have you heard from them, and what are the concerns you have right now?
Well, we have heard nothing yet, because we believe this is not a circumstantial case. It's becoming a pattern now that children are dying while in detention or in the care of federal government at the U.S.-Mexico border or by immigration authority. This is not the first time that this happens. In the previous administration, during the Trump administration, 6 children died because of the conditions in detention. And we believe that this was going to change in this administration. Now, unfortunately, you mentioned it already, 4 children had died already in these detention centers under the custody of the federal government. And we believe that there is no major change in terms of revamping the emergency procedures to provide health care and emergency care for these children that are in detention.
We mentioned 4 children have died in U.S. custody, another young girl dying in May while detained by Border Patrol. 6,000 unaccompanied minors are currently in HHS custody. What improvements need to happen? How do you save lives?
Well, the first thing is that we believe that children, specifically children and minors, they should not be in detention centers. They should not be in Border Patrol stations. They should not be in ICE detention centers. They should be immediately released either to sponsors or family members, but specifically it should be a procedure to have an initial health assessment of every child that Border Patrol or any other agency is finding at the border, and also have a complete medical procedure in case of emergency. In all of these cases, I think emergency healthcare had come late. That's why these children had died. So I think it has to be a revamping of the process, a new strategy at the border, and maybe they start creating welcoming centers instead of putting children in detention centers.
Yeah, a new strategy, certainly at the border. Fernando García, thank you so much, sir. Appreciate it.